Infectious disease specialist Dr. Simone Wildes for more. And doctor, thanks for being with us. Let's start, though, with that grim milestone. More than 800,000 lives lost in the United States to COVID-19. Think back to when it began. Could you have imagined this? What does it say about this, and what do we need to do?
Terry, it's really unfortunate that we're at 800,000 deaths in the U.S. I mean, it really breaks my heart. And I think we have to do everything we can to make sure we protect ourselves. I mean, I might sound like a broken record. I think we really have to encourage everyone to get their vaccines if they haven't done so yet, your boosters, getting your children vaccinated. And of course, the things we've been talking about, wearing your mask, social distancing, and washing your hands. I think we have to continue these measures if we all want to stay healthy and well.
And it's in our hands to do that. So the World Health Organization is warning that this new Omicron variant is spreading at a higher rate than any previous variant, although it does seem to cause less severe disease. So, it's a new thing in the world once again. How concerned do you think people should be?
We're very concerned about this new variant. We've seen it's more transmissible, and the symptoms are a lot milder. But that doesn't mean that we're not going to get more people that are going to be hospitalized. That means more people that are going to require more services in the hospital, which puts more burden on the healthcare system. And of course, that might result in more death. So we have to be very concerned, and again, just take all the precautions we can to make sure that we can get through this safely.
Well, Dr. Anthony Fauci suggests that 2 doses may not be as effective against infection from the Omicron variant. That apparently the studies are showing that the booster is necessary. So what should people do?
Well, Terry, we do know that the data shows that the 2-dose vaccine doesn't work quite as well with regards to protecting us from this variant. However, what we are hoping that when you get your booster shot, that will increase your antibody levels and thus help you to fight the infection if you get it. So again, bottom line, get your booster shot if you haven't done so yet, because we want to make sure that as this variant spreads, that we have many people protected.
Well, and here's the question now. We're 2 years into this pandemic, and this Omicron variant is so transmissible. You look what's happening in Cornell. Look at the professional sports leagues that Trevor was talking about. So what should businesses and institutions do? Do we have to go back to locking down? Are people going to accept that? We have this wildly transmissible virus. Is that what we're going to have to do, do you think?
Terry, I don't think we're going to go back to locking down. I think we're going to have to reevaluate the protocols that we have in place. There are some that might need some adjustments, and I think people have to be open to making those adjustments and providing more testing, making sure that we give patients on individuals opportunity to get their vaccines if they haven't done so. I am sure hoping that we don't go back to going to a lockdown, because that would be very distressing to all of us.
We all feel the same way. We all have to pull together to help each other out as we get through this, once again, another tough passage ahead. Dr. Simone Wildes, thanks very much for being with us.
Thanks for having me.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.